Hi, my name is Sarah, and I'm the Director of Patient Care at Pure Wellness Medical. And today we're here with Dr. David Suarez, and we're talking a little bit about hormone therapy. Is it right for everyone? So, Dr. Suarez, maybe you could tell me what's the youngest age that you treat, that you can treat?
Well, we generally don't treat children with hormones. We do have certain treatment plans with vitamin supplements and peptides that may help children, but generally this is for adults, usually in their late 30s and up. And they will benefit the most because they obviously are going to have the most hormone imbalances.
Okay. Are there any people that should not take hormone replacement therapy?
Well, most people are good candidates for hormone therapy, but obviously we're not going to offer treatment to pregnant women, breastfeeding women, or patients with active cancer.
Okay. Are there any special conditions or health risks that require medical clearance for HRT?
Well, if you are, like we said, a pregnant woman or a breastfeeding woman, we're not going to treat you. We have to wait until you're done breastfeeding.
Okay.
Other medical conditions, your doctor may want to see if you're a good candidate. Generally, if you have high blood pressure and cholesterol or diabetes, then you would come to us and we do an evaluation of those things also. A lot of times, if you have a doctor that's a little bit hesitant because they haven't had the education in hormone therapy, they don't understand the benefits. So we usually spend a lot of time just trying to explain to you how you can benefit. There's a lot more problems of not having your hormones balanced than there are from taking hormones.
Okay.
There's very well publicized risks of hormones that have been publicized, but it's not using bioidentical hormones. The risks were generally stated from very poor quality studies and trials. And those risks were increase in blood clots, heart attacks, strokes, and cancer. But in reality, if you don't optimize your hormones, you have an increased risk of insulin resistance, diabetes, heart disease, and even cancer.
Oh, wow. Okay. So I know that you said pregnant women and women nursing are not candidates for HRT therapy, but what about after I finish nursing? My hormones are a little bit out of whack then. Am I a candidate then for HRT therapy?
Well, generally women of a childbearing age, you don't get the whole protocol. We don't ever replace your estrogen if you're making estrogen. But yes, you would definitely be a candidate for some of our protocols because your body goes through this crazy imbalance and it tries to get back to homeostasis or where it's supposed to be. And sometimes after pregnancy, you never get there. So your body's constantly trying to figure out where that is.
Okay. So do you treat only men or women, or can you treat both? Like, say I was on the program and my partner wanted to join, what are the options?
Well, we definitely treat men and women. We have
Okay.
found that a lot of our new patients get treated and then their partners want to get treated because they see the difference in their partner's lives. So it ends up being a household treatment because you can't treat one and not the other because they get jealous.
Yes. Okay. And what hormones do you use?
Okay, well, there's generally just 3 types of hormones. And let me share my screen. So we have synthetic hormones, and synthetic hormones are man-made, they're mass-produced, so you can't really get an exact dose. And if you think about it, right, so if you needed a medication of 1 milligram, you could mass produce 1 milligram. But if your next door neighbor needs 1.25 and your neighbor across the streets need 1.5, it's just not cost benefit for a company to make those many different doses for everybody. So they kind of go on generalizations. The other problem with synthetic hormones is they have, you see on this diagram here, so this is the receptor site and this is the hormone itself, they have these side groupings that don't necessarily fit in that receptor site. So you have an increase in breakdown products, increase in metabolites, and therefore you have a possibility of increased side effects. The next type of hormone we have are natural hormones. And natural hormones are taken from other animal species. They're very similar to our hormones. So you usually will have less side effects because you have less breakdown products and less metabolites. So you'll have less side effects than you would with synthetic hormones. But the best of all is bioidentical hormones. And when you're talking about bioidentical hormones, you're talking about the same exact molecular structure of our hormones, not the source of the hormones. So they can also be synthetic, but they're generally made to be exactly the same molecular shape. So therefore, as you see here, it fits exactly in that receptor site. So you're going to have less breakdown products. You're going to have less side effects, less metabolites. So you'll be able to tolerate higher doses so you get all the benefits and less of the problems.
Thank you so much for sharing that diagram. That made it so much clearer. I had one other question. What is pellet hormone therapy? And do you offer it? I heard a little bit about that, but I just wanted to ask you for some more information about it.
Well, again, bioidentical hormone therapy is where the structural shape is identical to our hormones. And pellet therapy is a type of bioidentical therapy. So what it is actually like a disc, a little pellet of bioidentical hormones. And what happens is it gets inserted under your skin. So it's a minor in-office surgical procedure. And the way it's supposed to be is that this hormone is inserted, you have a higher dose, and then over time, it slowly dissipates. And what we have found is that patients deal better with a daily dosing or a bi-weekly dosing instead of an every 3 to 6 months dosing, because you get a high level and it slowly declines. And when does that level decline, right? So we kind of like, our body's like that steady state where if you're going to have a fluctuation, it's a lot smaller in a day than if you would have something for 3 months that slowly declines, because eventually you're going to get to the point where you don't feel well. So the way pellet therapy works is that you get that next insertion of your pellets before you start to feel symptoms. But that doesn't mean your hormones are at a good level at that point. The other problem with pellet therapy is it's inserted under your skin. So you can get a small scar. And we plan on keeping you on therapy for the rest of your life. So if you're young like yourself and you started pellet therapy, are you really going to get a scar in your body for the next 40 years?
Exactly. Yeah.
Doesn't sound too attractive.
I definitely wouldn't want that.
So that's why we stopped doing it. I was trained in it. I thought it was a great option. It tends to be a lot more expensive. And who really wants a scar on their body for the rest of their lives? And the scar never goes away, and you need multiple scars to have multiple insertions.
Okay. Thank you so much. Thanks for going through, who's the right candidate for hormone therapy. I really appreciate it.
All right. Nice to talk to you. Ciao.